All right. Well, thank you guys all for coming so much and joining us tonight. I am Taryn Strickland. I am the current vice president with the North Carolina Athletic Trainers Association. And I'm also the head athletic trainer at Green Level High School in Cary, and we are a member of Wake County Public School System. So I work in the public high school setting and have been there or in that setting for about 14 years. Um, Maura, do you want to go ahead and introduce yourself? We'll just go across on my screen. So Maura, then John, then Nina.
Sure. I'm Mara Carter. I am one of the co-chairs for the Young Professional Committee for the NCATA. I am the head athletic trainer at Green Hope High School, which is conveniently right down the road from Taryn. So we are also located in Cary and are part of the Wake County Public School Systems. And I think this is year four that I'll have been at Green Hope.
John?
Good evening. I'm John Schneer. I'm the Director of Health, Safety, and Wellness for the North Carolina Independent School Athletic Association. I'm excited to collaborate with the NCATA for both the public and the private schools as in regards to the secondary school setting. So happy to be here.
Nina, you're next.
Hello, I'm Nina Walker. I'm the past president of the NCATA and currently the public relations chair for the NCATA. Just on this as an interested party and, can't wait to learn lots about the secondary schools.
And then Jana, I know you're driving, so if you can give a quick introduction, that would be great. If not, I'm happy to do it.
Thanks, Taryn. Hopefully, I'm in a spot where people can hear me. I'm Jana Fonseca. I'm the Director of Health, Safety, Wellness, and Student Services for the North Carolina High School Athletic Association. Going on year four in that role. I'm actually driving home from the coaches clinic. So as soon as I get home, I will jump on my laptop, but am very grateful for this opportunity and excited to collaborate and just be a part of some really good information sharing as we get ready to start fall practice next week.
All right. And I saved the best for last. Nancy.
Welcome, everyone. I'm Nancy Groh. I'm the North Carolina Athletic Trainers Association president. I'm super excited that our PR committee has decided to collaborate and put on this event for you all, and really excited to see how many participants we have. So I'm going to let them take it from here. But again, y'all enjoy and learn.
Awesome. Okay, well, I'm going to go ahead and share my screen and everybody in here, again, you are muted. I realize that, but feel free to put any questions that you guys have in the chat as we go. And we will either address them kind of as we see them or, at the end, we've got some time reserved for questions. And then Jana is also going to take some time at the end of our slides to provide some updates from the North Carolina High School Athletic Association. So those will kind of be at the end as well. So, she's here to kind of answer any questions that you guys may have. And then John Schneer here from the Independent School Association. Maura, all my co-hosts, if y'all will just keep an eye on the chat when I'm going through my slides and vice versa. And if we want to wait till the end to answer the questions, that's fine. Or if you feel like it makes more sense to do it now, just interrupt me. Everybody can see my screen. Just thumbs up from the people that I can see. Okay, awesome. So we will go ahead and get started. Our goal today is really just to review the important health and safety rules that we do as athletic trainers every day in the high school setting. We have gone through and differentiated between independent school and public school regulations when applicable, but for the most part, these things are kind of apply to both settings. So we are going to start just by reviewing these forms that we are all probably very familiar with. So our pre-participation paperwork review, just want to stress that athletic trainers should be reviewing these next few forms. The first one is the health history form. Parent and student are going to fill these out. It is valid for 365 days. And those schools who are using Dragonfly, it is it does now have a date in. There were a couple years ago it didn't, but it does have a date, so it will expire, if they fill it out, um, in March, it will expire in March of the next year. Just take some time to review these. I stress to my parents, make sure you are looking at it and not just having the student fill it out. And then I always check if they're uploading a photograph or a PDF to make sure I have that parent signature, to make sure I have the athlete signature, and to make sure that form is dated. A lot of places, a lot of schools fill these out electronically, which is fine. Then it automatically, collects those things. But a lot of people do upload PDFs or screenshots. So just a quick reminder there. The next thing we should be looking at is our pre-participation evaluation physical examination form. So this is the first of two forms that the physician will fill out, or the licensed healthcare provider. This form is valid for 395 days. And again, schools using Dragonfly. I can only speak to Dragonfly because that's what we use, but schools using Dragonfly, it is programmed to include those extra 30 days. So the expiration date includes that extra 30 days. Important thing on this form, make sure you are checking for a signature, not just a stamp. And also make sure that we are entering the date of exam into that physical date rather than the date that it was signed. So hopefully most of the time at the bottom, the physician or the healthcare provider is writing the date that they saw the student athlete. But every once in a while, you'll notice above the form, on the top part of the form, DOE, and it's a different date. Okay. So the date of exam is what the date that we go by for that 395-day expiration. So again, just like to stress that athletic trainers should be reviewing these forms, checking for those things. Another thing I notice is that a lot of forms are missing the student athlete name and the student athlete date of birth at the top. That's what ties that form to that student. So just make sure that all of those fields are filled as you're going through and looking at these forms. And then the last page, that's part of that physical evaluation. This is the second form that the healthcare provider should be filling out. Same things on this form, check for name, check for date of birth, make sure they are included on both forms. Make sure a doctor has checked an eligibility box. So I do get some where no box is checked. And then check again at the bottom for a signature. So a lot of times the physical exam form will be signed and the eligibility form will not be signed, or vice versa. We need to have signatures from the healthcare provider on both of those pages. And again, the date should match. I always change the date on the medical eligibility form to, if the physical exam form was filled out on a different date and it says the date of exam somewhere, that's what the medical eligibility expiration date should be as well. So just things to double check. Obviously, review any recommendations from their healthcare provider for further evaluation, and follow up with that athlete if need be.
And quick clarification on that paperwork real quick. Somebody asked if it was 365 or 395 for the health history. In Dragonfly, at least it has it set at 395, unless that's changed to 365 and Dragonfly hasn't updated it yet.
Oh,
Can
okay. It may
clarify
be
that one later.
395. It may be 395 because it's part of the that whole packet. So it may be 395. I thought I had noticed that it was set to 365, but you may be right. We can double check that. All right. The next thing that we just need to make sure that we are reviewing and collecting is the concussion statement form. So the student athlete parent custodian concussion statement form. Double check me on this, but this one's good for 365 days as well. A year, not 395. Many schools collect this electronically, which is fine. That's an easy way to do it. And again, in Dragonfly, just gives you a checkbox. It doesn't give you a date. And essentially on June 1st, it resets. It resets everybody. So this one, it's kind of, you do it once during the school year and it's done. There is a date on it where they sign it, but it does not populate that way in Dragonfly. Another thing to note about concussions, it is required that all coaches, parents, and student athletes View the concussion crash course video on the North Carolina High School Athletic Association website. So schools have different ways of disseminating that video. Some do it in preseason meetings, some link it in their athlete registration form. So they have to click on that before they can acknowledge the concussion statement. And then there is a link to this course on the High School Athletic Association website, which does have a data collection method. It asks for student athlete name, parent name, and then they allow you to track who has filled that out. I will just encourage you to check with your school district leaders before distributing that, because we have been told, I know in Wake County, that we can't collect student information in that form and it's not secure. So we have other ways of distributing that video. So just come up with a plan to ensure that all student athletes, all parents, and all coaches have viewed that video, which is available on the Athletic Association website. All right, and then just some quick reviews about concussion management. Again, we've all kind of been doing this depending on how long we've been in this setting for quite some time, but there were some updates, pretty significant updates. I believe it was last year to this process. And, the biggest one is that student athletes can start stages 1 through 3 of the return to play while they're still symptomatic. So just kind of some reminders there. It's highlighted in yellow at the top. We need 24 hours between steps, whether we're symptomatic or not. And it says, that on a scale of 1 to 10, we can't have a symptom increase of any more than 2 points. And that symptom increase should last no more than an hour after that exercise. So in order to move on, to the next phase and not have to repeat that phase. So just make sure that you're checking in with your athletes during these first 3 days and saying, hey, doing a symptom score after each session, making sure that even, if they do have an increase, that it's a mild increase, no more than those 2 points. And repeating that day if you need to, if those symptoms don't go back down. And then just a reminder for any first responders or anybody who works with first responders who may be monitoring this return to play protocol. After stage 3 is complete of that return to play protocol, if a first responder has supervised it, they will need to sign in order to advance them to stage 4 and communicate email, phone call, text with the licensed healthcare provider who saw that athlete before they advance to stages 4 and 5. So just sort of an extra step in there to make sure we are progressing the athlete safely, but that conversation needs to occur between the first responder at the school and the licensed healthcare provider after step 3. And then it will happen again at the completion of the return to play process after stage 5. And that licensed healthcare provider will need to physically sign the entire return to play protocol at that point. And then last sort of concussion related update until Gianna comes on. But last summer sometime, physical therapists were added to the group of people who were able to diagnose and clear concussions and kind of guide that return to play process. State Board of Education has recently adopted that law as state board policy. So there are some changes coming to the Gefeller-Waller paperwork, which Jana will talk about. But just know that under state law and under state board education policy, licensed physical therapists are now, under this list of providers who can manage concussions. There is the caveat, which, excuse me, Jana will probably talk about as well, but, the licensed physical therapist needs to have experience and training in concussion management. So, Kind of what that looks like, I will let Jana talk about at the end. But just know that there is that change in there. All right, so moving on to emergency action plan, John.
Sure, sure. Hey, everybody. John Schneer again. Hopefully, everyone on the call is familiar with an emergency action plan. But as noted, the Gefeller-Waller Practice Act sets state law not only for concussions, but also for our emergency action plan compliance. All of your emergency action plans must be venue specific, as I'm sure you all are aware. You have to define the roles. It must be in writing. It must be posted. It must be distributed to your coaches, your administration. Please be sure it has been reviewed on an annual basis. The document needs to be updated and signed annually. It needs to be rehearsed. I recommend rehearsing it not just every year, but every season. We all have seasonal coaches, and it's important for those coaches to be aware each season. Make sure it's been signed off by your administration, whether it's your head of school, your principal, your AD, and that emergency action plan must be reviewed by a licensed athletic trainer in the state of North Carolina. If you're a first responder and you don't have an athletic trainer at your school, reach out to your sports medicine advisory committee and we will get that reviewed for you, public or private. So make sure your school entrances are labeled on. We have templates for this for your emergency action plan. If you need a template, you can reach out through the North Carolina Independent School or through the Public School Athletic Association. But define your locations and be as specific as you can on those emergency action plans. Put a yellow star, describe where it is, look for the field lights, whatever it may be, but make it easy for those people that are coming to your campus to help you find their way into your campus. Many of our campuses have 4, 5, 6 entrances, and it can be very difficult for those emergency services to arrive. Your AEDs must be within 3 minutes of the location that they're going to be used at. Do maintenance on your AEDs. Check when the pads expire. Check the batteries. Document everything that you're doing. Protect yourself by having an appropriate EAP. Again, rehearse, rehearse, rehearse. I don't care if it means walking out in the middle of a football practice, a soccer practice, the volleyball court, whatever it may be. Drop some mannequins and say, the coach just went down. What are you going to do? See how the students react. Have roles, delineate who's going to go get the AED, who's going to go get the athletic trainer or the first responder if they're not right there, who's going to act first, who's going to start providing care. Again, we need to be aware of who's at all of our practices and game situations so that the slowest person is not sent for the AED, right? If they have to run somewhere, find the appropriate people. Sometimes it may not be an adult. I've seen multiple times in my career where the adults freeze and then the kids start to act and react. So call on the kids if that's the case, but practice, 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 and put your coaches on the spot. They all are required to have their CPR or AED training, so ask them to help, ask them to step in. And finally, there's the Gefeller-Waller seasonal compliance checklist. I encourage you to keep this on file. Go through and check it off. Make sure you're meeting the state law and requirements. It is a state law to have it posted. So if I come on your site, Jana comes on your site, and you don't have an emergency action plan posted, it can potentially be a fine. So make sure you've gone through the checklist, have it documented, and protect yourself from liability. Game day administration, pre-game collaboration. I can't stress this enough. Public school or private school, there are forms that are linked here. Please take a moment, not just at football, take a moment at every sport and say who you are, who you're there for, how you can be reached if you have to step off the field, but take the time to meet the other coaches, the administrators, the other healthcare providers on site, first responders or athletic trainers, shake hands, make face contact so that in the emergency situation, you can make eye contact across the field and be prepared. We need to know how the EAP is going to be activated if you're the away team, where the ambulance and entrance is going to be, who's going to be in charge, where are the security officers. If you can ask all those questions up front for just 5 minutes in the pregame meeting, it'll save you a tremendous amount of time in a crisis situation. I really encourage everyone to do this for every sport.
All right. When we are looking at athletic training responsibilities and first responder responsibilities and requirements, if you are acting as an athletic trainer or a first responder, please know that you cannot be coaching at the same time. You can be a coach and a first responder, but you cannot be doing both at the same time. Football specifically, in season, you have to have an athletic trainer or first responder on the field. For all practices and all games, you need to have your athletic trainer on both sidelines, unless there is a certain circumstance, in which case you would need written permission from your superintendent that is excusing you from that. Let's see, 7-on-7s for the summer, you do have to have an athletic trainer present or a first responder present. If you are splitting the field, having skill guys on one side, linemen on the other side, you have to have two athletic trainers or first responders on each side because it's considered to be two different competition spaces. Wrestling requirements, there needs to be an athletic trainer or first responder that is present for all matches. That means you are basically mat side. So if you have an athletic trainer or if you have matches that are going on in an aux gym and in the main gym, then you need to have an athletic trainer or first responder in both of those areas. For the independent schools specifically, there needs to be somebody on site for all of those practices for wrestling. And then for boys lacrosse, for the independent schools specifically, there needs to be somebody on site for all practices. You don't need to be necessarily on the field, but you need to be on campus. And then for all of those home games, there needs to be somebody physically present at the field. Okay, our athletic training requirements, you need to be certified, you need to be licensed. If you are coming from a different state, make sure you're reading over what the North Carolina laws are and what our scope of practice is, because it will be different versus coming from whatever state you're coming from. And please know that there is no grace period. You need to have that license from North Carolina. You cannot work unless you have that license. So please know that there is no grace period. So if you are coming from out of state, then that needs to be a priority. Our first responder requirements, and I think John's going to talk about the independent schools. So this is specific to the NCHSAA schools. All first responders, this needs to be completed before the first day of practice. You need to have a CPR and AD certification as well as first aid. Those do need to have an in-person component to it. I know the NFHS Learns has a concussion or a CPR aspect to it, but there's no in-person component to it, so that unfortunately would not satisfy that requirement. You need to have that concussion sports training. That is good for 365 days. And then you need to have 10 continuing ed. Sorry, the chat keeps popping up on my screen. You need to have 10 hours of continuing education. They do recommend going to that coach's clinic that was in Greensboro the last couple days to get those CEUs out of the way. If you are unable to do those, then they do recommend doing the NFHS Learns, the heat illness, sudden cardiac arrest, ACL management, mental health, anything that is pertaining to athlete safety. And then Gatorade Sports Science is also another opportunity where you can get some CEUs, and most of those are free. I think you do have to pay for some, but those are another great way to get those CEUs.
Athletic first responder requirements for the Independent School Athletic Association are slightly different. We require the 5 NFHS courses that are listed, the collapsed student athlete, skin infections, cardiac arrest, heat illness, and concussion in sports. We also require CPR AED first aid certification to be updated and completed. Then we have a requirement that you must attend and participate in our athletic first responder status education session with our SMAC. We're holding that actually for the fall tomorrow night. And if you are a first responder in the independent schools and you need to get that done, please register, fill in the requirements, upload your certificates and certifications in the coursework. After the completion of that SMAC course education, you will have a quiz, and then you will be asked to sign an AFR understanding of scope of practice. And we can move on to that next slide if you'd like. The AFR, or the athletic first responder that we've titled it in the independent school, has a limited scope of practice, and we just are really clear with this. And up front, the AFR's primary responsibility is to recognize and refer. They are not there to act as athletic trainers. They are not there to present themselves as athletic trainers. But again, recognize and respond to a life-threatening situation, activate the EAP, administer CPR, get the AED, provide basic first aid, stabilize and monitor, and communicate pertinent information to the EMS. That's the primary role of an AFR. We cannot portray ourselves as an AFR to be an athletic trainer. You're muted, Taryn.
Okay, sorry. What can y'all see now? Can you still see the presentation?
Yeah, you're good.
Okay. I'm not able to get back and change it.
Here, the heat illness prevention slide.
I know, I just can't advance to it. I'm not a good Zoom user. All right, let me stop for 1 second. Sorry, y'all. All right, are we back?
You're good.
Okay. My tools are going away. Okay, so talking about heat illness prevention and acclimatization. Hopefully we've all seen this lovely little chart for our wet bulb globe temperature and our different flag guidelines. So just a couple of notes, sort of best practices about this. You can add equipment. So if we start in red at 3 p.m., we can add equipment as practice goes on if it gets cooler. But I will advise everybody just to be careful with this. Make sure you're paying attention to your athletes. And if they've been out there in really hot weather for a long time and there are not drills that they need to put those pads back on for, it's probably a good idea not to if it can be avoided. But you are able to add equipment as practice goes on if the flag temperature, if the wet bulb drops and you're within those guidelines. I would just caution you all to be careful and keep a close eye on kids if you are doing that. So just keep that in mind. The next bullet point says, you can make more cautious accommodations. So especially when we think about football, there are a lot of things that we can do if maybe we're in the yellow flag, but we know that it's early on in the season or early on in the summer and our kids aren't acclimated yet, let's have them remove helmets when they're not in drills. Let's increase the duration and the frequency of their water breaks to more than every 20 minutes. If we need to. And again, just can't stress enough to keep an eye on your athletes, especially those linemen. At the bottom there are the guidelines that were released by the NFHS a week or two ago on how to prevent exertional heat stroke in football linemen. And Jana may speak on that a bit more. But review those with your coaches. Make sure you have a good understanding of them so that we can keep everybody safe. Reminder, these guidelines are for practices and scrimmages. They do not apply to games. However, we do it a lot with tennis matches at my school that we play at 3:30. If we know it's going to be really hot, we really try to push those start times back. Before school starts, we're playing some at like 8 a.m. To avoid those hot temperatures. Also discuss with your refs and your coaches ahead of time. Like if you know it's going to be a really hot football game, talk about adding in those water breaks ahead of time and maybe shortening the game or the periods or whatnot if you're able to. Some tips for getting an accurate reading with your Kestrel heat stress tracker. When we're measuring wet bulb, it can be really challenging at times to get an accurate reading if it's really cloudy or really windy, or if you have passing clouds. When the sun's out, it might be 92. You might have a wet bulb globe temperature of 92. But then the clouds roll in for 5 or 10 minutes at a time and it drops down to 85. So a really good practice in those scenarios are to take an average. And I took this average, my little screenshot on a very cool day, a cool morning. But if you just hit that right arrow button when you're on the wet bulb screen on your Kestrel, you hit start, set your timer, and I take about a 15-minute average and I go by that average number in the middle. So your minimum might be 82, your maximum might be 91. But if your average is, within the red flag or the yellow flag, for that extended period of time, then you can probably go with those accommodations. So just something to try on those days where it can be really challenging to know what you should do. Um, and then a couple of reminders, let the device acclimate outside for at least 15 minutes. If it's in your air conditioned training room, it's going to take some time to kind of come up to temperature. So factor for that if you're taking your measurements and making those decisions. And then just make sure that you're recording or you're measuring this every 30 minutes. You might need to do it a little bit more. Again, if you have those different variations with cloud or wind, it could change pretty rapidly. Another thing, and I know that this can be really challenging with a lot of our schedules and teaching and whatnot, but it is really important to take this at each physical site. There are microclimates. There are these little areas, these little pockets of really high humidity on our campuses, or obviously the surface. A black track is going to be hotter than a grassy field. But I've had several times where down low, kind of in a swampy area at my baseball field, my wet bulb globe temperature reads 2 or 3 degrees higher than it does up top on my practice fields. So just be aware of that and know that you can have a lot of variation from site to site. Another thing is that Kestrel recommends that you recalibrate this device every 2 to 4 years. I kind of took that recommendation from their guidelines and went with what I think most of us use it for, but they do have specific guidelines based on how you use that Kestrel and what conditions it's in for how often you should calibrate it. So that is another thing that we really should be doing too. You buy the calibration package, you ship it off to them, takes a week or two, and they ship it back to you. But just to make sure that you're getting accurate readings. All right, so we just wanted to review this. Your coaches should be handling this, your football coaches, right? You should not be the one in charge of, who's been here day one, who's been here, 3 days. But we kind of forget every year what days kids can do what. So our gradual acclimatization procedures for football, from the High School Athletic Association, days 1 and 2, they should just be in helmets. They should be in non-padded shorts, a t-shirt, no girdles, no shoulder pads. Days 3 and 5, they can add the shoulder pads. Shoulder pads and helmets, still no padded shorts, still no pants. And there's no like full tackling or contact during these days for obvious reasons. And then day 6, we have full gear permitted, and that's usually their first day of real contact. This starts the first day of preseason. So for public schools, that will be a week from today. Next Wednesday will be day 1. So even if they've kind of been wearing that protective equipment during the summer, they need to take it off again for days 1 and 2, and follow these acclimatization procedures. If a student misses a day during this 6-day period, they have to complete a day to make up for it. So if a student's there on day 1 and then misses day 2 and comes on day 3, they don't get to put shoulder pads on day 3. They got to go back and do their day 2 in just their helmet. And then just another note at the bottom, a player has to have 8 days of practice to scrimmage. So day 9 is the first scrimmage day. So in addition to that acclimatization period, we've got those requirements as well. All right, weigh-ins, I think everybody's favorite. Yes, this is still me. Okay. So the handbook says that pre and post practice weigh-ins should be conducted. And Jana, you can correct me if I'm wrong. I believe that is for all sports. It is kind of listed under the just the general health and safety rules. It's not in the football section.
It is just in the general prevention of heat illness section,
Right.
yes.
Right. So the verbiage is that it should be conducted for all sports. I think most schools just do football. I am not saying that is what, should be done, but that is certainly the highest risk sport and where we see it most often. But the guidelines for that, for the purpose for those weigh-ins, if athletes are not within 3% of the previous day's pre-practice weight, they need to be withheld from practice, and counseled on their nutrition and their hydration. So you're looking at your pre-practice weights, pre-practice weight day 1, pre-practice weight day 2, and those are the 2 numbers you compare. And if there's a 3% or greater drop, that athlete should be withheld from practice due to the risk of heat illness. My question at the bottom, is just a reminder to make sure that you are checking these as the athletic trainer. I know a lot of coaches handle this just because it's a lot, which is fine, but just make sure that you are going back and looking at those weights every day before practice to know who you have to pull, because the coach is probably going to be less likely to pull a kid or recognize that a kid has lost 3% of their body weight than you are. So stopping and starting weigh-ins. When do I start weigh-ins? When do I stop weigh-ins? There is not specific verbiage in the High School Athletic Association handbook about this. And Jana, please again correct me if I'm wrong. Typically, if you are in a position where you need to be measuring the wet bulb globe temperature, if it is during a time of year when there is a risk of heat illness outside, that is when weigh-ins should be done. So most schools in my county start taking them during summer workouts, June 15th, whenever they start those summer workouts, through at least Labor Day. I have extended them later through September if it's been really hot. But essentially, when I don't have to fill my cold tub every day, and measure the wet bulb globe temperature, every day is when I stop doing weigh-ins. Do you have anything to add, Jana?
I don't know, just because we don't
Okay.
have a very distinct date, because I think we've all seen situations where it gets cool in September, and we've seen situations where it stays hot until October. So,
Yep. Thank you. All right, so just some reminders about what your heat management setup should look like. We should all have a rectal thermometer. I did learn this year that these also need to be calibrated. So the manufacturer recommends every 2 years, you recalibrate these devices. Again, you can go online, find the address where you ship it to them. I think it was $65 this year. and they ship it back to you. So keep that in mind. Also, don't store your batteries. Store your batteries separate from the device. So in your little case in your kit, don't put the batteries in it. Just make sure you have a fresh set of batteries ready to put in it, because those batteries will corrode that device too. We should all have an immersion tub. And then the next two options I think are great for travel, or if you're at a random field. I keep a tarp in my travel kit, so that if there's not that tub readily available, I still have something that I can use to rapidly cool somebody. All right, Maura, you are up again.
All right. Looking at lightning, before we even have any lightning emergencies where we need to call anything, please make sure that you are assigning a staff member. I'd say most of us, it's probably you as the athletic trainer or first responder that is in charge of looking at the weather and calling that. But in some cases, it could be your athletic director, it could be somebody else. So make sure you know who is assigned to monitor the weather for that day. Make sure you also have an evacuation plan. We know it should be a substantial building. If it's a big game, we can't always have fans and stuff going into the school building. So in that case, they can go into their car. A school bus is also considered a safe vehicle if you are unable to get players into the school. That is determined that that is a fine place for them to be. So looking at the rule itself, if you hear or see lightning, then you need to suspend play and then go to that safe shelter. So every time you hear thunder or you see lightning, that 30-minute timer essentially resets. So it doesn't mean that it's just 30 minutes and then you keep hearing thunder, you keep seeing lightning at the end of the 30 minutes, stuff has been going on and you still see it. It needs to reset every single time that you hear it. I think a lot of us probably use WeatherBug or something similar, or have devices at our schools. However, they should not be used independently. There's the position statement on this specifically is linked at the bottom of this if you would like to read through it as well. But it does not support using just technology. You're encouraged to monitor the weather, use your ears, use your eyes. Can you see it? Can you hear it? And not just relying solely on the device itself. Heat lightning, if you're seeing those flashes, more so we see this in the nighttime than we do during the day. If you see it in the clouds and you don't see like bolts coming down, like those streaks, it's usually not an issue. Again, use your common sense. If you hear thunder and you see that, then you should suspend play. And then making sure that you are reviewing that annually with your team, with your coaches, your athletic director, any administrators that could be at the game. That could be part of that emergency action plan review that John talked about earlier. Hey, here's what we're doing for lightning. This is where everybody is going. Skin infections, everyone's favorite. The NFHS has a lovely description of what each of these things look like, and I think I linked a flyer at the bottom of the slide too, that has pictures of all of them. If anyone is ever confused as to is this something else or is it this? So there's also a skin release form that needs to be filled out if somebody is diagnosed with any type of skin infection, any bacterial infection, any viral infection. Depending on if it's viral or bacterial, the return to play is going to look a little bit different. So any of those bacterial infections, it's usually 72 hours before you can resume participation, as long as the lesion itself is not actively draining. So if it's been 72 hours and you've been on the appropriate medication and there's still some leakage in it, it's not recommended that you participate. For any of those viral infections like herpes, shingles, cold sores, that is going to be a little bit different. It can be anywhere from 10 to 14 days depending on the infection. So skin infections, this specifically with that form, it's recommended for all sports. However, we focus more with the contact sports. If you have a tennis player with a cold sore, there's a very low chance of transmission for that happening during a match than if it were to be a wrestler with a cold sore that is actively draining. So again, use the guidelines, they're there, but more so for contact sports, but can obviously be used for any of those.
All right, it's me again. Okay, so we are going to talk a little bit about establishing minimum weight and weight certification for wrestling. We've got some time for this, but I think again, this is another thing that athletic trainers every year kind of have to brush up on and refresh. So I'm not going to go through all of this. We are going to download these slides into a PDF and email them out to everybody who's registered. Um, and we are going to share the recording on our website. So you will have access to this, or if you want to screenshot it now, more than welcome to. But just some best practices to keep in mind when we are starting this minimum weight certification process. So for our hydration test, we need to be using a refractometer. Best practice, we need an adult in the area where they're providing that urine sample. Um, Lots of different ways we can do this. A coach can be there with them. If you have like a staff bathroom or a place where you can be in the bathroom, but we just want to make sure that they're not putting water in that sample. So 1.025 is our threshold for the urine specific gravity. They need to be at or below that. And then we can move on to their body fat assessment. If they fail, we need to wait at least 24 hours, but no more than 72 hours and do that urine test again. Okay. Hopefully they pass trial 2. If they don't, same thing, wait 24, no more than 72. We do trial 3. Okay. If they are above 1.030, they become ineligible for this season. If they are borderline, so above 1.025, but below 1.030, we can move on and take their body fat assessment, but they're going to move up a weight class. If they pass, if they're below 1.025, you can move on with their body fat assessment as normal. Okay. So just kind of a good visual. Again, these are things I always have to review every year because I can't remember how long I'm supposed to wait and whatnot. And then our body fat assessment, we'll measure each site 3 times. For our boys, it's the abdomen, the subscap, and the triceps. And for our girls, it is the subscap and the triceps. So again, need to do all of these things in order to establish their minimum weight. Another kind of best practice, make sure you are writing these on a piece of paper and then entering them into track wrestling, or writing them and entering into track wrestling at the same time. That written piece just kind of serves as a backup if you do mistype something, if you do have an error that you need to go back and correct. You know the measurements, you have documentation of what the measurements were, and it just becomes a much easier process to get that corrected. Okay, so our minimum body fat requirements, and there is a change here from the High School Athletic Association. So the minimum body fat requirements for high school wrestlers is 70% or 7%, excuse me, or more for males. And this year it will be 19% for females. It was 12% in the past. That policy has changed, so it will be 19% this year. If they're below the minimum, there is an appeals form. It's the same appeals form if they want to, appeal their skin fold measurements or appeal their minimum weight. There's just different sections of it, and that form is linked at the end of this slideshow for you to take a look at. But if they are below that minimum weight, their physician has to complete the appeals form that essentially just says this is normal for them. I feel that they are healthy enough to participate in wrestling at this body fat. And then that form needs to be sent to Jana within 14 days of the measurement for her to go in and make them, eligible to wrestle. Another thing, you must be an approved assessor in order to take those skin fold measurements. There is a form on the High School Athletic Association website. So if you are going to a new school, or have another person, who will be recording measurements at the school, you need to complete that change in assessor form prior to the start of that process and send it to Jana Fonseca. And then on the right-hand side is just the appeals. So if a wrestler is appealing their minimum weight, they can either request that the initial calculations are recomputed by the school personnel. So essentially, re-enter the values that they got at the first measurement back into track wrestling and see if, there was an error. And if they don't accept that recalculation, they can request to be remeasured by the same person. And then they choose which measurement to accept. Okay. Their weight stays the same. They don't get reweighed. They don't have an opportunity to lose more weight. So we're going to keep that original weight. So that's important for them to know. And then the second option is that they need to be hydrostatically weighed at an approved facility that the skin fold measure approves. And then they can submit those numbers to the High School Athletic Association. Do you have anything to add to that, Jana?
No, the only other thing Eric put in the chat is, how long to hold on to the documentation. Really until everything you're confident that the numbers are right and the measurements have been committed. And I actually shared this same process with the wrestling coaches at the Coaches Association meeting, and I encourage the coaches, and we'll share with you guys as well. There's a way to do a practice transaction in track wrestling. I would recommend, and I told this to the coaches, there's that 2-week window that you have to do the initial assessments. You can start the initial assessments in practice. Use the practice transactions, especially for the coaches. And if it's a weight that they didn't think they were going to see for a certain kid, an experienced wrestler that's coming back at a certain weight class that they expect, they can remeasure as many times as they want to and put that information into track wrestling. We just can't change it once it's been committed. So I reminded them of that, that they had that opportunity to plug the numbers into that practice transaction if they need to kind of see what the minimum wrestling weight and then subsequently what the weight class is. I would hang on to those forms for the duration of the season, Eric, just to be safe. Same consistent with what we tell wrestling coaches for weigh-in sheets, just to hold on to them over the course of the season and in the event that there's any question that comes up.
Awesome. All right. And then just last two things that we have. Just a reminder that return, if an athlete misses a certain number of days of practice or competition due to an injury or illness, they are required to be cleared by some sort of licensed healthcare provider. So this form on the right is the illness return to play form. So if an athlete misses 5 or more consecutive days to an illness, they need to be cleared by a physician, a PA, or a nurse practitioner. It does not have to be this exact form, but it does need to be in writing. So this form is great, covers all the bases. If you can get it to your athlete to have them take it to the doctor, that's great. But if not, if you have something in writing that says Susie, had the flu and can come back on this date, that's acceptable as well. If it is due to an injury, the athletic trainer is able to clear them. I would just encourage you all, if you are not the person seeing and treating that athlete due to an orthopedic injury, I would not be the one clearing them, right? If they are seeing somebody outside of your athletic training room for care, that person should be the one clearing them. And just a note for football, if an athlete misses 5 or more consecutive days due to either injury or illness, they need to participate in 3 separate practices before playing in a game. So kind of, if they're out for a physical ailment of some sort, they need 3 practices before they can play a game. They can't come back, to practice on, Thursday for walkthrough after missing Monday, Tuesday, Wednesday, last Thursday, Friday, and play in Friday's game. And this is the injury return to play form on the right. Again, does not have to be this exact form, but this one covers all the bases. All right, so here is where we linked all those great things that we talked about. So we will provide that to you all. And before we kind of go back through, actually, I might hand it over to Jana first, and then we'll go back through the chat for questions. So before I hand it over to Jana, I just want to remind you all of some NCATA programs. So the left is our Oath program, our athletic trainers helping. This is a program for NCATA members where grants are provided on a, basis for things, equipment for schools that is needed that is not funded by your school or your booster club. We provided a lot of assistance to schools that were affected by Hurricane Helene. Does not have to be anything major, anything catastrophic, but if you are struggling to get equipment that you need, check out the Oath page on our website. Our Catastrophic Care Collective, this is a new collective, new committee with the NCATA. This committee is focused on tracking catastrophic injuries, especially those with athletic trainer involvement, but at schools and our student athletes, collecting those data so that we can use that information to drive policy change, to help provide better care to our athletes. So we work closely with the Catastrophic Research Institute over in Chapel Hill. And then lastly, I just sort of wanted to introduce Beacon. That is another committee with the NCATA. And they do a lot of talks similar to this on kind of, different groups, providing healthcare to, sort of more niche groups, groups that maybe need more special consideration. So they have a talk coming up in August, which we'll share with you all on rural health, so healthcare in the rural settings. So just keep an eye out for them. And then my last plug for the NCATA is to save the date for our symposium in 2027. It'll be March 12th through 14th, and that will be in Hickory, North Carolina. So mark your calendars. We'll get you guys registration information and hotel information January 1st, but keep that on your radar. All right, Jenna, do you want me to pull your slides up or do you want to share that?
Yes, I think just to be safe, I don't want to
Okay.
screw anything up because I joined from my browser and my computer's being weird. So if you can just share, that would be great. Thanks.
All right. Is it up or no?
Not yet. It's still yours.
Okay. Ah.
Here, let me see. I think I had it pulled. Nope, it closed again. I don't know what's going on.
Can y'all see it now or no?
No, it's still just you. Oh, wait, here it comes. There we are.
Got it?
Okay, yes, thank
Okay.
you. Okay, super. So you can go ahead and move to the next slide. This was touched on already. The biggest change for wrestling, and this is actually an NFHS rule that was done at the suggestion of the NFHS Sports Medicine Advisory Committee, which NCHSAA has chosen to adopt. But we went through the process for that already, so you can go ahead and go to the next slide. The first article here was already referenced in terms of additional ways that we can prevent exertional heat stroke specifically to football linemen. Link to our website here, as well as the full article that it was adopted from. The NFHS came out with a one-pager that was intended to go to football coaches. So this has been sent out to NCHSAA member football coaches. It went out in Dragonfly about a week and a half ago. And I also reviewed this as part of the coaches clinic updates, part of the rules clinic, as a resource for football coaches as well. And then the NFHS SMAC also came out with an additional one-pager with guidance for football coaches to, again, minimize risk in football conditioning or football practice drills. They did not come out and say you cannot do drills X, Y, and Z, and they're all listed in the article, but they, again, strongly recommend that coaches discontinue drills that, create unnecessarily high-speed head-on player contact. So, again, that has been sent out to NCHSAA football coaches by way of Dragonfly within the last week and a half. You can go to the next slide. A couple of national initiatives that I would like to take an opportunity to remind this group of. High School Rio is the data collection platform that the NFHS uses to guide decision making. So this is a way for athletic trainers to collect injury data at their school level, submit it to High School Rio, which is part of Daedalus, and then again, when group comes to the NFHS and says, we would like to see a rule change, if there's any health and safety implications, then we have that objective data to go by. So I realize that it is another administrative burden if you as an athletic trainer choose to participate in it, but it is a really meaningful tool that can be used both at the national and the state level to direct change and to guide change in terms of health and safety. And you all went through the physical form earlier. We have been informed by the NFHS Sports Medicine Advisory Committee that the 6th edition of the form, as well as the book that supports how it was developed and all the clinical evidence behind it is coming out at some point this fall. We, as the NCHSAA, would not make any changes mid-year. If it does, in fact, stay on that timeline, which I'm cautiously optimistic that it will, we would have our Sports Medicine Advisory Committee review it, and then we would implement that in the fall of 2027. So be on the lookout for an updated PPE form. And go ahead and go to the next slide. As of this weekend, these are schools that do need to be updated in Atlas. Again, we ask that schools take time to do that every couple of years or so that we make sure we have accurate information. We were doing pretty good as of this time last year, but because it does roll over, we want this to be updated. I will also be reaching out based on the information that I have in Dragonfly to the schools that I know don't have athletic trainers, to the athletic directors, for them to complete this again so that the information is as up to date as possible. And you can go ahead and go to the next slide. Just a couple of more local handbook changes. We had implemented for rescheduled football games. The Sports Medicine Advisory Committee for the NCHSAA wanted a full 3 calendar days in between rescheduled games. This fall, we got a lot of pushback about that, specifically for rescheduled JV games. So the SMAC was able to kind of work through that and then came out with different guidance where it needed to be 60 hours from the conclusion of the first game to kickoff of the second game, but with the added caveat that there could not be any contact practice in between. And again, that only applies to rescheduled games. The second item on here, the 5 missed days of practice, there are no changes to the health and safety standpoint. We did have another line in there that was causing some confusion. So student athletes that missed, let's say they were attending a funeral or something like that, we removed that verbiage completely. So it's up to the schools that if a student athlete misses practice for a reason other than illness or injury, it's at the school's discretion how they want to handle that return. We did sanction flag football for the fall of 2026 and men's volleyball for this to begin in the spring of 2027. But at the guidance of the NCHSAA Sports Medicine Advisory Committee, did not set requirements on medical coverage for either of those 2 sports. So that will remain a local decision. Next slide. So I think you touched on this as well, as far as the law that now allows physical therapists to have a role in concussion management. This is precisely how the law reads. It's an amendment essentially to the Gefeller-Waller law that adds physical therapists as licensed healthcare providers who can be involved in the evaluation and clearance of student athletes who have sustained concussion. And the NCHSAA forms have been updated. I have gone through those with a pretty fine-tooth comb, but and they're updated on the website. But if anybody sees a place where PTs were missed in that list of licensed healthcare providers, please reach out and let me know, and I will make sure that that gets updated appropriately. Next slide. We did want to put out some guidance for schools, specifically for, student athletes and parents. And this was done kind of in conjunction with the Sports Medicine Advisory Committee, as well as our legal counsel. So obviously we know that PTs can now provide clearance for concussion. Go ahead and go to the next slide. But what the law does not include was, specific verbiage saying that those PTs have to have training in concussion management. We all obviously want that. I talked to a PT at the athletic injury management course who kind of spearheaded this, and he, as a PT, also said, we wanted this for access for our student athletes. He also, as a PT, said, I hope other PTs who are approached to clear student athletes from concussion have taken, additional training in concussion management. But please know that that was not expressly stated in the law. So go ahead and go to the next slide. So we do encourage, and we want to encourage student athletes and their parents to reach out. And if they are choosing to have a PT, be a participant in the return to play protocol or in any portion of the care. It's up to the student athlete and the parent. Hey, do you as a PT have training in concussion management? And certainly this really just is in alignment with everything that we've done, completing the return to play protocol, but obviously having a clearance decision that reflects a comprehensive evaluation and adherence to that return to play protocol. Next slide. I did want to touch on this a little bit just because we saw an influx in our office of requests for tinted visors this past year. So we do have the appliance form that lives on our website that's intended to be used for hard, rigid casts on the upper extremity anywhere. That form, when it's completed, does not need to be approved through our office. It just needs to be presented to an official prior to any game. We had an uptick in requests for tinted visors this last year. Those are illegal per NFHS rule. The NCHSAA has now a rule exception request process. That information, the request that needs to come to me first. We are not publicizing this process. It's not openly out on our website. We want people to be reaching out with questions, which is why we're doing that. It's intentional that we're not putting this rule exception request form out there. If a student athlete is looking for a rule exception request to wear a tinted visor, our sports medicine advisory committee physicians are not going to entertain that request unless there's written documentation from an optometrist or an ophthalmologist. They are not going to entertain a request that's from a kid's PCP saying the kid's photophobic. We need some pretty significant, I see John giggling about this because he's probably had the same conversation with many people, but we need to see some pretty significant medical documentation in order to grant that tinted visor. And the darkest that we would allow is the smoke. We are never going to allow a kid to play in a full blackout visor. Other things that are going to require a rule exception request. We had a couple of really interesting cases last year where we had student athletes that were deaf, and as part of their regular school communications had ways to enhance audio for those student athletes to get that information from teacher, to student in the classroom. The NFHS prohibits use of electronic communication devices in football, for example. But we were able to work with the student athlete, the school, their healthcare providers, our sports medicine advisory committee, and grant them a request so that this individual could play football with this device in. We are not, trying to put up barriers to play. We really want to work with student athletes and work with schools to give these kids the best possible opportunity, but also do it, within the confines of the rules and without there being a competitive, disadvantage. Excuse me. Use of a golf cart is always going to need to be an exception that comes out of our office. That's intended for, student athletes, perhaps with, cardiovascular issues, that golf is the only sport that they can play, but they get, very fatigued and very tired when they're walking. That's something that, is going to be entertained. I don't mean to make light of this, but we had a student athlete that had bilateral toenail removal 2 days before the regional golf tournament. They were not allowed to use a golf cart because that's a short-term thing. And frankly, you probably should have planned a little bit better. So those are, again, some examples of some of the rule exception requests that come through our office. So anytime that a student athlete is looking for an exception to an NFHS playing rule, that would be a rule exception request that does have to come through our office. And typically those only last for 1 year. We're working through, renewals and what that process looks like. But that's just something that we saw an increase in this last year. Next slide. We do ask athletic trainers to make sure their information is accurately updated in Dragonfly. That is our source of information to send out information to athletic trainers. We ask the same thing for ADs. We ask the same thing for coaches. We ask the same thing for first responders. The first responder requirements that Mara mentioned earlier, those are all built into Dragonfly, and they don't have a green check mark in Dragonfly until all of those first responder requirements are uploaded and approved at the school level. At the NCHSAA, we also implemented and gave the ability for schools to upload their EAP as part of their fall eligibility summary. That was really our first step in measuring to make sure that that was done. You know, this has been part of the law since 2011. I go out and look for them when I go to site visits, but we did not have a blanket way of making sure that schools were actually complying at minimum with having an emergency action plan. So I feel like this is a start, a step in the right direction in terms of really assessing compliance with that. And I did want to take this opportunity to remind folks, the NCHSAA doesn't mandate the use of Dragonfly for student athlete eligibility. We only require its use for coaches. And I say that because I hear a lot and we experience a lot in our office of frustrations with Dragonfly. Yes, it's free when it's provided by the NCHSAA, but it's not the only option when it comes to student athlete eligibility. So I just wanted to make sure everybody was aware of that. Next slide. And a final reminder, the NCHSAA Foundation is now a completely separate entity from the NCHSAA as a result of the Memorandum of Understanding with the Department of Public Instruction. But they do offer education-based grants. This cycle, the grant cycle, has actually changed this year. It's shorter. It still opens on September 1st, but now the deadline is November 30th, and there is a category for health and safety grants. Additional AEDs, a new wet bulb globe device, immersion tanks, anything like that. Those are all things that are very strongly considered. And we actually do have an athletic trainer that sits on the review committee for these grants and is asked to look at the health and safety grants and weigh in. So it is not going to somebody that doesn't know the importance of those life-saving equipment, emergency equipment. So that grant opportunity is there for our member schools. Next slide. Okay, that was all I had. Thank you so much.
Awesome. Thank you for that. That was great. All right. Now that is all we have to present. I know there's a bunch of stuff in the chat. Excuse me, Maura, John, do you want to help me sort of sift through and kind of see what we still have not answered?
It looks like there's a question about the handbook. Jen, I don't know if you can see the chat or not.
Yes, I think we actually removed the word consecutive a couple years ago to alleviate that. And I am actually going to look right now, but I feel pretty confident that we removed the word consecutive because there would be a situation, let's say there's a practice and then a game and then a practice. And we didn't want to necessarily like punish a student athlete for missing. I'm not saying this very well. We took out the word consecutive. I'm going to leave it at that. But I'm double checking right now.
Awesome. I was just scrolling back up. Was there a question about summer coverage? Oh yes, Crystal. ATC is not required to be present during summer equipment or not. Yes, that's correct, Crystal. I do think there was some confusion a couple years ago about a statement that was released, but it was retracted about athletic trainers having to be present in the summer for football. So yeah, unless it's a 7-on-7, they can wear equipment, and an athletic trainer or first responder does not have to be present. And John, you said the same thing for y'all.
Yeah, I responded
Yeah.
to Caitlin.
Perfect. Okay. We talked to how long should we keep the written measurements? How long was the turnaround? I don't have it back yet. I just sent it off it got there on Monday, and I begged her to send it back to me by Tuesday, and she promised me she would. So I think they say like 3 to 5 business days plus the time of shipping. So it is pretty quick for that. And I can look up the website. I found it literally in the paperwork that was in with my rectal thermometer, the website to go to, and just called the woman, and she was very nice. So we got start date, Derek. We got D. Oh, is there
So
Alex?
this is the beauty of how we have things listed like three different places in the handbook that say the same thing. In the general health and safety area, the word consecutive has been removed. However, in the football specific section, it still reads if a student athlete misses 5 or more consecutive days of practice, they must go through 3 separate days of practice. So it's still in the football section, the word consecutive, but it's not in the general health and safety section.
Good to know.
There's a question about first responders who provide coverage to a school in addition to ATCs, how to manage and report their education. Jenna, correct me if I'm wrong, that has to be in Dragonfly, all first responders as well. So
Yes.
they would just need to make that account, select first responder, and then they can upload all of those requirements, the concussion and sports, the CPR, first aid, and then those CEUs. The only caveat with the CEUs that my first responders have figured out is that you have to put all of them, like all of the certifications that you have, like have them do it on one document, download that document, and
Yes.
then upload
Yes.
that because uploading 10
Yes.
at a time is not, Dragonfly doesn't like it.
No, or you can PDF merge them into one
Yep.
document, like one multi-page document. Yes.
And the independent schools have to upload theirs to me.
Is there Atlas for middle schools? I don't believe so. Does anybody else?
I don't think so.
Yeah, I don't think so. Steve, oh yeah, and then Eric, um, Crystal is correct. They can wear equipment in the summer in June, July, and an athletic trainer or first responder does not have to be present unless it is a 7-on-7. So they can wear shoulder pads and helmets. They can't wear pants. They can wear shoulder pads and helmets, and we do not have to be on site. My guess is that they mandated that because many schools probably don't have funding for athletic trainers in the summer. But unless it is a 7-on-7, they can wear their helmet and shoulder pads, and nobody has to be on site. Amber, all schools should be uploading into Dragonfly. High School Athletic Association schools should all be uploading into Dragonfly, yes.
Allison, yes. If you can assign one person to multiple schools, that way we can see that schools have somebody in that role.
Holly, yes, only shoulder pads and helmet, no pants, no girdle. Eric, it's in the handbook. I'll find it and I'll send it to you. It's phrased as if helmet and something to the effect of if helmet and shoulder pads or if protective equipment is being worn, an athletic trainer or first responder must be present during the school year.
School year.
So that's what that's like where that is. So it says during the school year, which excludes June and, that second half of June and July. But I can find that and send that to you. Anything else? All right. Well, thank you all so much. John, Jana, Maura, thank you all so much for helping put this on and for being here tonight. I know we all have busy schedules. We will email you if you filled out that Google form and I have your email address in there. I'll email you the PDF of the slides so you've got the links. And we'll probably find a place to share that on our website too. So if you didn't get that email or, want to share it with someone, you can email me vicepresident@ncata.net or we'll get it up on the website soon. All right. Have a great evening, everyone. Good luck next week.
Good luck tomorrow to those independent schools that are starting tomorrow with football if you appealed to start early.